morning. My apologies, but traffic is much worse than I used to experience it when I used to come down here on a regular basis. My name is Roman Gower. I was born and raised and lived my whole life in Toronto. I'm 57 years old, 34 years married with 2 children, one 19 and one 26, because we still keep feeding him cheese. With my mother and my mother-in-law in long-term health care facilities, I've always been keenly aware of the state of our health care system. I was aware of the many statements of the Minister of Health proclaiming that we need to fight for the right of all citizens to have health care that they need when and where they need it, regardless of how much money they have in their pockets. We bill late, the minister said. It closes loopholes that allow queue jumping and extra billing and made two-tier health care illegal in Ontario. Well, ladies and gentlemen, I'm here to demonstrate that that was, at best, disingenuous and at worst, fraudulent. In October 2006, I was diagnosed with colon cancer. After successful surgery in November 2006 to remove the tumor, I was referred to the Trillium Health Center Oncology Clinic in December. That I used so far was okay. It got me through surgery, got me to that point. After further testing, it was determined that I was positive metastases to my lymph nodes and possibly my liver. In February of 2007, my oncologist prescribed Avastin for my treatment. He informed me that Avastin, a Health Canada approved drug, was recommended by Cancer Care Ontario as a standard therapy for my disease. He indicated this critical drug, however, was not covered by OHIP. He stated that the hospital was prepared to absorb the cost of injection of the drug as part of my overall chemotherapy, but that I would be responsible to pay the $2,637.50 cost per injection for the drug, if I wanted it included. I needed 12 injections of this drug. I must say I was stunned at the prospect of a $32,000 personal expenditure for an approved drug to be administered in a hospital. I guess this health care was not really all that good after all. What I really needed was I needed this, my Visa card. I have with me receipts for 4 payments to the Trillium Health Center, each in the amount of $2,637 for my drug injections so far, all on Visa, and also a bill for a private infusion clinic, which was another avenue that I explored early on in my treatment. This two-tier health care, I'm paying for hospital injection of a medically necessary drug. That is in direct violation of the Canada Health Act, as it states that drugs administered in hospital are to be covered by our health care providers and systems of the province. We have asked the federal government, which has the legal responsibility to intervene and give clear instruction to the government of Ontario that hospital-based cancer drugs are covered by the Canada Health Act and patients not be charged. The government of Ontario has collected well over $2.5 billion in health care premiums. So why are we not getting the prescribed drugs that the law prescribes they should be paying for? 40 years ago, I had the pleasure of going to Expo 67. For those of you old enough to remember, there was a wonderful pavilion there that Ontario had. It was magnificent. It featured a movie called A Place to Stand with a wonderful song. And you all know it. It went, and we built Ontario, a place to stand and a place to grow, Ontario area. Well, ladies and gentlemen, I'm sorry to say that Ontario for cancer patients is now a place to die if you can't afford the cost of the drugs. Thank you.
Okay.